Health Minute is brought to you by St. Francis Health. We listen, we heal.
Welcome back. Well, scientists have identified a new group of COVID variants, and some fear they could lead to a wave of infections. Mandy Gaither reports.
In less than 2 months, the KP.2 variant has overtaken JN.1 variant, becoming the dominant strain spreading in the U.S., now causing around 28% of COVID-19 infections.
There's some suggestion that it might be more easily transmissible. It does not, however, seem to be causing more severe disease.
That's the first thing Dr. Priya Sampath-Kumar with Mayo Clinic says people should know about this new variant, which is one of several being called flirt variants, spreading at a time when experts are coming up with formulations for the fall COVID vaccine.
The WHO recommended that the JN.1 strain be the basis of the vaccine, but now in the US, they're reconsidering whether that would be the case or whether they would need to focus on this newly mutated strain instead.
Sampath-Kumar says the current vaccines may not work as effectively to prevent transmission, but she says getting one can still prevent severe disease from a COVID infection. Next, the doctor says the flirt variants cause the same kinds of respiratory symptoms as earlier variants, such as cough, fever, headache, and muscle aches. Because the new variants appear to spread easily, they could fuel a summer wave of the virus.
People are going to be traveling on vacation, going to ball games, going to concerts, etc.
Finally, you can protect yourself and others by washing your hands, masking in crowded areas, and if you're sick, stay home. For Health Minute, I'm Mandy Gaither.